Hi, everybody. Welcome to another Beta Change Minisode. I'm Katie, and today we're bringing you something different that we haven't yet done with our Minisode series, which is interviewing someone with audio. So today I'm going to be talking to you from New York, and today we're chatting with Cate from Kenya. So Cate is an advocate with T1 International, a global advocate. Last year, we had interviewed T1 International's founder, Elizabeth Rowley, and we are talking to Cate today about her 30 years living with type 1 diabetes in Kenya. And the reason that we're doing this is because we wanted to highlight Universal Health Coverage Day, which is coming up in December. So for those of you who don't know, Universal Health Coverage Day is happening on the 12th. And the mission is to advocate that with strong political will, every country can build strong, equitable health systems that leave no one behind. Okay, so we've got Cate here. She's going to tell us about her diabetes journey and give us a little introduction.
Hi, Katie. I'm very happy to be part of your interview today. My name is Cate Ndwiga. I'm from Nairobi, Kenya. I was diagnosed with type 1 diabetes when I was 5 years old. So to date, it's been 31 years. It hasn't been an easy journey. Being brought up by a single mom, being brought up in one of the biggest ghettos. It's called Dandora. Maybe some of you have heard about it. It wasn't easy, and the nearest hospital we could go for access to insulin or access to consultations and physicians was in one of the referral main hospital, Kenyatta National Hospital, and from where we lived to there, it was quite far. So everything from the beginning to even now was just too expensive. At some point, I could go for some days without insulin. You could even go buy insulin, then you don't have syringes. So it's been quite a tough journey, I can say that. And of course, with lack of insulin, with the lack of good follow-up, with maybe sometimes lack of diet, things just happen and you start getting complications. As much as they tell us, if you take your medication well and you're good in diet, some of these complications can be delayed, but unfortunately, some of us even die along the way. So I would say it hasn't been easy. It's quite tough, and right now, I'm going through some of the major diabetes complications. I'm not working. I'm a single mom of a daughter. She's 10 years, growing bigger each day. She's my joy. But diabetes, for me and for all of us, not even in Kenya alone, I read a lot of stories in the T1 group. I'm one of their global advocates, and it seems that we're going through the same thing depending from where you are, if you're in the US, if you're in South Africa, if you're in Kenya, wherever you are, the problems are the same. And it's quite disappointing. So we are hoping with the Universal Health Coverage Day and what some of the countries are trying to do, we will be able to get the support that we need. Thank you.
Cate's story is really inspiring. And I think, thinking about all of the challenges that we all face with type 1, especially, the things that don't involve type 1, like motherhood and working and all of the other things that we do with our lives. Those are just made especially more challenging by type 1. So thank you so much, Cate, for sharing. And Cate is actually raising money at the moment, or looking to raise money as a fundraiser. So Cate, why don't you tell us a little bit about that? I think she's recording her answer now. So for those of you who are tuning in, the way that we're doing this interview today is via WhatsApp. So because of Cate's internet in Kenya, we wanted to do a live interview but we're needing to be a little bit more creative about it than doing it the traditional minisode that we normally put on. So once I receive Kate's response, I will play that for all of you. And in the meantime, I have some photos of Kate that she sent me about her advocacy efforts. And again, this is Cate Ndwiga, who is talking to us from Nairobi, Kenya today. We're talking about universal health coverage and why it's important. And again, I'm Katie. I am coming to you from Beta Change today. So thank you for joining us for this mini-sode. If you have any questions about Universal Health Coverage Day or anything like that, please feel free to leave them in the comments. I'd be happy to talk to you about them.
Katie, it's very unfortunate that every time you need to get extra treatment or every time you need to get treatment, if you're a diabetic patient or you're suffering from any non-communicable disease, you need to fundraise for you to be able to access healthcare. And that is one of the annoying factors here in Kenya. It has affected me. Now I'm being forced to fundraise so that I can be able to go for treatment for my total hip replacement surgery. It had been costed at 3 million. This is because of all my other complications. And you can imagine raising 3 million is not easy. And that's why we've been trying to fundraise and using this fundraising to show people or to show the leaders in Kenya that universal health coverage is very, very important and it's needed. And they should listen to us. They shouldn't just start working on universal health coverage from their own point of view. They should listen from us patients and hear our point of what universal health coverage will really mean for us. That's where we are. The fundraising is still continuing because since 2017 up to now, I've not been able to go for my surgery, but I'm just hoping soon and very soon I'll be able to go for at least the first hip surgery. So that's where we are.
Yeah, I think also, it is extremely wrong that patients have to pay for their own healthcare. And I think that Kate is so brave for taking this on and, really dealing with this challenge. So thank you so much for sharing, Kate. I really am so impressed with all of your advocacy work. And I was wondering if you might want to share with our audience some of the things that help you stay motivated, especially, as a single mom and all the other things that you do that are not diabetes related. If you can share those, that would be great. And here are some of the hashtags you can use to promote Universal Health Coverage Day when you're sharing your thoughts about that, which hopefully you will, because I think that the more voices that are heard, the quicker change can happen. So that's what we are hoping here at Beta Change as well.
Yes, why I wanted to become an advocate and actually a T1 International Advocate, I realized that apart from people being diabetic, there was a lot of stigma and there was a lot of people not accepting themselves. So once you're diagnosed with diabetes, most people self-esteem just went on the down low. Parents who had children with who were diagnosed with diabetes just, lost hope with life. And then there was a lot of inadequate education on diabetes. People did not understand what diabetes was. There was so much myth about diabetes. You just go somewhere, you're seated, and you said, let me just ask people about diabetes. And everybody will just start saying their own things. Diabetes is caused by eating a lot of sugar. Diabetes is caused by witchcraft. Diabetes comes from certain areas of the country. There was just a lot of inadequate education. So there was a lot of awareness that was needed to be done. But all these years, I'd never met a group or people who were so, how will I say it? People who were so passionate about teaching people about diabetes. People were so passionate about changing the issues of the diabetic patients until I met Elizabeth from T1 International, and I was so amazed with the work that they were doing. And that's when I decided to join T1, and that's when I decided to start just doing advocacy from home. And the funny bit was, this time I'm deciding to do advocacy. I'd just been diagnosed with end-stage renal disease. I was going through dialysis, and I was becoming weak day after day. I was not working, so I didn't even have finances to support my advocacy in Kenya. But I said it did not matter. If I'm going to teach people about diabetes through the internet, through the social media, through the T1 network, that is what I was going to do. Even to be invited in a church and talk about diabetes, that is what I was going to do. Then fortunately, after joining T1, I don't know what happened. People just started hearing about my story in Kenya. And I was also chosen to be one of the non-communicable diseases champion for one organization called National Council of Churches of Kenya. And from there on, my advocacy in Kenya just became awesome. I had two organizations that were supporting me. There was National Council of Churches of Kenya, there was T1 International, there was Kenya Defeat Diabetes Association, and my advocacy just rolled out. And I decided, let me start talking at least to the young people, especially from where I came from my community. So just talk about diabetes anywhere I went. If I was in hospital, just on the line, on the queue, waiting to be served, I would talk about diabetes. If I'm in the bus or if I'm in the taxi being taken to hospital and the driver I'm using did not know about diabetes, I'll just start talking about diabetes and asking questions. And I used the social media a lot because I was now at home. Then just along the way, after I was diagnosed with kidney, that was in 2016 May. In 2017 April, unfortunately again I fell and I dislocated both my hip joints. Now I couldn't walk, I couldn't stand, I couldn't do anything for myself. I was now dependent on other people. I was no longer independent with my diabetes, with my kidney, with now my severe bone disease. I have low vision disability. Life just became tough and tough and tough. But I decided I was going to continue with advocacy. And as long as I lived, things were going to change. As long as I'm alive, things were going to change. Even if I was not going to get the help that I needed, I would make sure that all the other diabetic patients would be able to access affordable insulin, access affordable diabetes supply wherever they were. And that is why I joined T1 International. T1 International is a very awesome group. They give you the support you want. They've been supporting me. At times, they just support me in everything that I need to do. And it's been awesome. It's been great. And they're very, very truthful. Not many organizations out there do what they say. T1 has been championing for diabetes, and it has been championing for diabetes worldwide, and they do it passionately. So me being part of T1 was just awesome, and it was a great thing. I'm even very proud to say I'm one of their global advocates. Thank you. Wow, the very, very first thing that keeps me motivated is my daughter. I look at my daughter and I feel very, very motivated. She's my strength. She's my joy. She's the one who keeps me moving on. And again, I read about stories of what I don't know. It's very hard not to talk about diabetic related issues. But at times you read stories from other areas, and you sit down and you say, now, if this is happening, and this is where I am, what do I really need to do? If I'm going through this, what is happening to that other person who has not yet even gotten an opportunity to even be diagnosed with diabetes? So, I mean, just going through, just seeing my daughter and thinking about how people misunderstand or misquote diabetes, I'm just moved. I just want to talk about diabetes all the time. I just want to teach people about diabetes. I would mention one thing, maybe on social media today, I'll say about this thing about diabetes. Tomorrow, I'll say about this thing. So, yeah, my daughter keeps me motivated. And since, unfortunately, the truth of the matter is that I'm not financially stable, and most of the time, I'm left to get support from my friends. My friends have been very, very, very supportive. T1 International, National Council of Churches of Kenya, these people have been very, very, very supportive. If it were not for them, I would not even have the strength, I think, to just wake up and talk to people about diabetes and give them strength to move on. Thank you. When it comes to universal health coverage and my advocacy program, I talk a lot about universal health coverage and diabetes, trying to make people understand what diabetes is, what the problem people with diabetes are going through. I have a lot of friends in Kenya who are also diabetic, and I usually tell them before even I go for a meeting or a forum, kindly guys, I'm going for this type of forum. This is what you're supposed to represent as diabetic patients. What do you want me to talk about? And they usually tell me, could you kindly ask them to reduce the prices of insulin? Could you kindly ask them to make sure that insulin is accessible and available in our level 5 hospitals, which are near us, which are in every county? Ask them to bring insulin wherever we are so that you're not forced to go to the towns, or people who are in the rural areas to be forced to go to the cities so that they can be able to buy insulin, and ask them to make sure the supply of insulin in the public hospitals is constant. So you don't go this month, you find insulin, then the following month there's no insulin.
You know, it's hard to imagine what it's like for people to not have insulin available. You know, it's a very shocking thing, and it's there's no reason for that. You know, in this day and age. So, Kate, is there anything else that you think you know really needs to change in terms of healthcare access? What are some other things that you're dreaming of changing in Kenya?
When you go to these hospitals, the insulin is not there. So they did this. Our government insurance, there's a card that you need to pay 500 every month if you're an unemployed person. So if you have that card and you go to one of the public hospitals in your area, you're able to access, you're able to see a physician, and you're able to get your insulin with that card. With paying nothing, you're not going to pay anything. That card is going to service your needs. But the problem is when you go see the doctor will write for you a prescription. Then when you go to the pharmacy, you find there is no insulin. So if you have this card, you buy the insulin with the card. If you don't have the card, you buy the mixed insulin at 200 shillings. That is a very good deal. It's a subsidized price. But the problem is, most of the time you go, there is never insulin in that pharmacy.
I've had that happen a couple times here in the U.S. You know, where there's no insulin. Sometimes, you know, the brand that I'm looking for, and it's I just don't understand. It's something that we need it to survive. It's not optional to take it. So the fact that this is still an issue today, I think, is just really sad, and I'm very glad that we have a voice as people with diabetes over why that needs to change.
So what happens? You're forced to go to a private chemist where you buy the insulin at double or triple the cost. And maybe at times the private pharmacy is not even near your area. So you're forced to pay for transport, and this becomes too expensive. So with universal health coverage, we're trying to make sure that all these things are looked into, and that if they're going to give us a government insurance card that will cater for all our diabetic needs, that will be fine. And we will appreciate that. And if you're a diabetic patient and by any chance you you come through a complication, this card should be able to cater for all your medical needs regardless. I think that would be universal health coverage for us. Otherwise, we will not see the importance of it. Thank you.
And I think that, part of what is so hard about even getting insulin today too is the cost. And here in the US, the cost is exorbitant if you don't have health insurance. So I think that it's really good to share stories like you just did of, how we can advocate for change. And I'm looking forward to hearing some of your ideas about ways we can change and also promote insulin for all, which is what T1 International advocates for.
Yes, there's a story that was in the media just the other day from a different county. The lady who has 5 children. 3 of the children, unfortunately, were born and diagnosed with diabetes. One died along the way because she could not afford insulin for all the 3. The other one is a big girl. She's in school. And imagine, the girl is forced to come out of school to walk a distance of about 5-6 kilometers to go to the nearest medical hospital to be able to get her insulin injection, then go back to school. She takes injection. She has 3 injections per day. So 3 times a day she has to come out of school, go to this medical center, get her jab, then go back to school. I don't think that's where we need to be in this day and age. No. This day and age, even if you're in school, even if it's what kind of school, you should be able to be near your insulin regardless. And this lady spoke, and I was so annoyed, and I was asking, what is happening? If the insulin, what is happening? You should not even be showing, people should not be suffering like this just because they cannot afford insulin. Now they have to go get their jabs from the medical center. It's so annoying. It's so unfortunate. I don't know what language we are going to speak because I believe we've talked a lot about insulin prices. We've talked to our leaders about availability and accessibility of affordable insulin. I don't know what language you're going to use, but what I can say is for all advocates who are advocating for #insulin for all, we just need to keep going until things change. Even if it's going to take how long, we are going to talk to our leaders. We are going to force it down their throats to make sure that we are going through issues. Just the other day on Tuesday, I was able to meet some of our county assembly members who are representing the health committee. And we told them our issues about non-communicable diseases and essential medicines. And I had to talk a lot about diabetes because I'm diabetic. And I told them that my story represents all people with non-communicable diseases. And they were shocked. I don't know if for sure they were shocked or they were playing shocked, but they had and ensure that insulin is affordable for all diabetic patients. We don't need children in school to be suffering. All the time you have to walk a distance to go to a medical center to get your jab. We don't want that. Things have to really change.
I agree. I really think things do have to change. And Kate, what would you say that the global community can do, either to help you in your specific situation with your fundraising, or in general, what would you recommend that people can do who might be interested in advocating like you are? And I think Kate is going to continue to share a story about insulin for all.
Education on diabetes. A teacher in a different county again, I think he got tired or he got angry. He was hungry and decided to go to a hotel to have his lunch. I think he had taken his jab and his sugars were going low. So he went to a hotel and he asked for a meal, but the waiters were taking long to serve him. So he just left on the table. And these waiters did not take it as, they were not concerned. So by the time they were bringing the meal, the guy had gone into hypoglycemic coma. And he just died there when people were looking at him. Then later on is when they were saying, hiya, this person has diabetic. And we think it's his diabetes that caused his death. And I thought, wow, if education can just be done everywhere, in schools, in hotels, in your community, everywhere you go, in the churches, we will save a lot of lives. Because some of us, at times, we're not even able to control our sugars, and you find you're going into hypoglycemic. You're in a place where you don't know anyone, and by mistake you just faint. We need people to know when you find someone has fallen just on the road. At times, it's not just alcohol. Don't assume that the person is drunk. Try and check. You might even find a bracelet. The person has a bracelet written "I'm diabetic," or the person has a card, and you'll be able to save this life. Thank you.
Yeah.
Another important thing, Katie, that I really I'm praying and I'm asking God to give me the strength to be able to advocate for it to change about healthcare. I'm just praying that tomorrow, after our advocacy, that we will be able to go to hospital and access everything that we need. We'll be able to see our diabetic physicians. We'll be able to access our insulin. We'll be able to access our diabetic supplies, our syringes, our strips, even if it's not for free.
But yeah, it's because you know, it's not just about the insulin; it's about everything else that comes with diabetes. Right? Yeah.
At least at a subsidized price. Yeah. They did it for HIV and AIDS. I'm sure they can do it for diabetes too. Thank you.
Yeah, that's a good point, Kate. You know, it's something that, you know, involves a lot of resources and a lot of education. But I think if we can make that point understood, it will only serve to better all of our communities in the end.
Katie, with my fundraiser, there's a link. Maybe I can share it with you right now. There's a link that we are using. It's a link. It's an online link. It works the same as GoFundMe, but this one is in Kenya, and it's very good. I've been receiving some donations from people outside Kenya, and we've been able to access the funds. So I would ask the global community if they can be able to donate whatever they have through the link. It would really, really mean a lot to me, and they shouldn't fear, because the link is it's a good link. It's an open link. Any money that is sent through this link, I'm able to access it, so they can help me. That is one way through the fundraising. I'll be sharing the link in a few. For all the other people who are interested to advocate, I'm telling them, please go on and advocate. If you think maybe you don't have the finances to advocate or what, you really don't even need money. If you have internet and you have a phone, use that one and you'll be able to start advocating. Talk about diabetic issues. Tell people about your story. Don't be afraid. Tell people about your story. Talk about diabetic issues. Talk about the solutions that we are looking for. And you will be surprised that whatever you're going through as a diabetic patient, regardless if you're a type 1 diabetic patient or a type 2 diabetic patient, you'll be surprised that the same issues you're going through wherever you are the same issues that other diabetic patients in different areas that are going through. So if you share your problems and you share our problems and we make them known, we will be able to get the support that we need as diabetic patients worldwide.
Thank you so much for sharing, Kate. We are really happy to be able to share your story today. So to help Kate, we can go to this link that she just shared with us. And we'll also be putting that up on the Beta Change website Facebook page as well. So keep an eye out for that.
As we come near to the celebrations of the Universal Health Coverage Day, I want to ask everybody who's celebrating, all the leaders, kindly, as you champion for universal health coverage, kindly look at the needs of all diabetic patients. Kindly support us, give us all that we need, and we will be a happy lot celebrating universal health coverage.
I think so too. Kate, thank you so much for sharing your final thoughts with us. Thank you so much again for joining us for this interview today. We really appreciate being able to share your story. And for everyone else, we've got more information up on betachange.org. Thank you so much, everybody, for joining. And thank you so much to Kate. And we hope to see you all soon.